Summer can be hot and steamy. Fall can have cooler temperatures, as we're talking about this morning in the east. Either extreme can have a major impact on the body, including those who suffer from chronic pain. Joining us live to talk about those impacts is Dr. Joseph Pergolizzi. Doctor, thanks for talking to us from Healthy Directions this morning. Tell us, first of all, I mean, our body's really like one constant temperature. How does hot or cold really affect the body?
That's an excellent question. You know, there's actually a science out there called biometeorology. And what we know is that it's not a perfect science, but that people will experience different types of pain with extreme temperatures. When it's cold, a lot of times we believe it's the barometric pressure that is going to cause inflammation in the areas of your muscles and joints, and that can cause pain. When we look at extreme temperatures and heat, particularly high pressure and the heat index, what we find is that people are going to have more dehydration related to their pain, and that can cause, again, muscle and joint discomfort. There are individuals who have chronic migraines that can also experience increase in their symptoms when the temperature is very hot.
Yeah. All right, so let's talk about who's affected the most. I would assume the young and the old would be affected the most. Am I right or wrong with that?
You're absolutely right. You know, the extremes of age, just like extremes in temperature, are going to be more affected. When you're younger, particularly when you're an infant or child age, you can have more sensitivity to the heat in particular. And that's why it's really important for parents, if their children have experienced pain-related symptoms related to very high temperatures, that you want to make sure you do bring them to the doctor, even if the symptoms resolve. And the same with older individuals. Older individuals, they tend to have more issues related to cramping and dehydration related to the heat and also to the very cold. This is where you may have inflammation in the muscles or joints because
Doc, I think we tend to hide from the cold a little bit more, but either way, what are a few ways to actually alleviate the pain brought on by hot weather besides staying hydrated? That's definitely probably number one.
Yes, stay hydrated. You know, carry a bottle of water with you. Avoid alcohol or caffeine. Choose the shade over sun. That makes sense. You wear wearable clothing that's breathable. And also, don't forget your sunscreen. And if you have pain, you want to put your pain topical creams on before your sunscreen so that you get good pain relief.
All right, how about, we only have about 30 seconds left. How about the cold?
Yeah, for the cold, you want to try to obviously move to a warmer area. Drink warmer fluids like teas. You may also want to add some sugar or honey in that so you get that immediate, yep.
All right, Dr. Joseph Pergolizzi, you did a really good freeze frame. I thought he was frozen for a second there. That's why I was like kind of slow on my question. I was like, did he freeze or not freeze?
You're pro, Doc.
On his, from Healthy Directions, we certainly appreciate that.